best to kind of work from this way as far as the covers. Just release them from the end and move them up. That way the top of the patient is covered. He stays a little bit warmer, and we're just exposing the area that we need. Now, in this particular class, if you see me sometimes come around and I know that looks really, but the beds are so nicely tucked in. I don't want to have to move the covers to feel. So you never know until you look below on these mannequins, because today this may be a female, tomorrow it might be a male. The parts come in and out, so you never know until you look below. But this is a female, and the reason why we're demonstrating the female today is because it's a little bit different from the male, and you don't have a video for the female. The video that I'm sure you all have watched prior to today was the male. Okay? So who would like to read? You want to read me?
Positions bed to a comfortable working height and lower side rails. Positions patient in dorsal recumbent with legs slightly bent.
Okay. Dorsal recumbent is with the legs bent, spread apart, as much as you can get them. Okay.
Student explains to instructor the importance and procedure of perineal care prior to performing sterile urinary catheterization.
Okay. Students seem to get kind of confused here. Peri-care is different from cleaning the area prior to putting the catheter in. So what that means on your checkoff form is that you're to tell me that before I began the procedure, I would get soap and water and clean the perineal area. Why do I want to clean it if I'm going to be cleaning it with the sterile stuff anyway?
Bacteria.
You want to start with the cleanest kind of area you can have, right? So clean it with soap and water. That's what we mean by that particular item on your checkoff. All right?
Opens catheter kit between patient's legs. The outer cover may be used as trash bag and placed on the bed.
Okay. I want to try to get this to where you can use it.
So are there two checkoff sheets? Like is one for the male and one for the female? No, there's just one checkoff.
So what they're talking about, the outer wrapper can be used as a trash bag. It's up to you if you want to do that or if you just want to use the trash can. What it means is to just sort of turn this down, and you can place that right here to dispose of your stuff.
Don sterile gloves.
Okay. Put this here. Okay, this kit is different. My gloves are underneath, okay? This morning the gloves were on top. So what I can do is just reach right here and get these. Now, if your kit is like this, what you're going to need to do is just find the very edge, lift that up and get your gloves. I would put your gloves on top. Because there are, the one I opened this morning, the gloves are on top, okay? But ideally, whatever's on top, that's what you deal with first, okay? We don't want to make it too difficult for you. So we're going to come over here, we're going to put our gloves on. Sterile? Yes. Now look at that. That's the way that was packaged. So I really would consider those contaminated, but I'm not. It's a terrible packaging job.
Yeah.
Isn't it?
That really is.
And these feel a little bit small to me, so that's why I brought me a pair that I know works well. So if you know that you have a size that fits you well, feel free to go ahead and just put it in your kit, okay?
Place sterile drape between patient's legs to create a sterile field.
Okay, I'm going to pick this up. And if you can see, that's a shiny side. This is not. So you can either just kind of drop this, and move it up, or
So you can touch it, like you can place it. Okay.
because it's all still sterile. Or what I like to do is take it like this and kind of fold it like this, and that way I don't take a chance of contaminating it on the thigh. This is a fenestrated drape. You're welcome to use it if you want to. We use it more with male patients, but you have to be very aware of contamination. And you can see that for a female, it's a little more difficult to use. So if you would like to just get that out of your kit, you can. Okay?
So use of fenestrated drape, let's use that. Places plastic tray closer to patient on sterile field and prepares cleansers, i.e. betadine, swabs, and lubricant on tray.
Okay, now it's funny. The kit I had this morning, there were betadine swabs in here. There were 3 swabs. This is betadine liquid, and I've got cotton balls. So what I want to do here,
We do have the swabs though. I think I have the one with the swabs in it.
I think y'all might have different ones. This morning we had some different ones, so whatever you got. So you open this up and you pour it over this, although we're not going to do it because the betadine stains the mannequin, okay? So pour that over.
So we wouldn't do that in the...
Not in
actual
real.
copy there? Okay.
And then we can go ahead and take our specimen container and get it out of the way. Okay?
Remove plastic wrap from catheter and lubricates 1 to 2 inches for female or 5 to 7 inches for male of catheter.
Okay? You need to keep this piece, okay? This is one of the hardest things, is taking this off and maintaining control of your catheter. Because if it happens to fall and hit the leg or anything, you've contaminated. Okay? Okay?
Uses non-dominant hand to position or prepare patient's genitals for cleansing. Following principles of asepsis, cleanses around urethra of female or urethral opening and glans penis of male. The student must not remove this hand prior to insertion of the catheter or sterility is compromised.
Okay, I'm going to back up a second. This is your sterile lubricant, okay? All you need to do is just squirt you a little bit out in the tray. You can squirt it right here. Then you can just place your catheter in it. You want to lubricate about 2 to 3 inches, 1 to 2 inches for the female and about 5 to 7 for the male. Okay. Now, this is my saline that I'm going to use to blow up my balloon. So I want to go ahead and attach that while I have 2 hands that I can do that. Because once this hand touches this, I can't use this hand anymore. And this is hard to do with one hand. So make sure that's tight. Okay? Now I'm going to come up here, we're going to place my hand, we're going to open the labia, and the reason why I wanted to show you the female today is because these mannequins, it's very difficult to open the labia up. They're stiff, and we understand that. So ideally, if you were cleaning and the labia happened to fall together, you've contaminated. You'd have to start cleaning again. But do the best you can. First thing we're going to do is clean the outer. Get rid of it. Clean the other side. rid of it. Now, if I have my trash bag down there, that's okay. But let me show you what we do not want to see you do. Clean and then come to throw it away. What have I done? So if you do that, you can do it this way. I would recommend either having your trash can there or having the trash can right here. Okay? Okay. So once you've cleaned, then what do we do?
Moves box closer to patient on sterile field, explains to patient that he or she is going to begin inserting the catheter, that the patient is instructed to bear down as if voiding, or take a deep breath and exhale during insertion.
Okay, so we're going to lubricate it. We're going to stick it right there at the hiatus. And if this was lubricated, it would go in easier. Okay. Push it in until we see urine begin to flow, and then what do we want to do?
Go in another inch.
Go in another 2 to 3 inches. And once that is in, we want to take our hand and hold it here. And we're going to blow our balloon up. We're going to tug, make sure it's in there. Then we're good to go. Now, one thing I do want to say about the female. What other opening do we have down here? A lot of times, if you insert this, and you've inserted it so far that you think it's going to come out of their nostrils, you're probably in the vagina. And that happens. If that does happen, leave that where it is, in the vagina, go get another kit, and now you know that that is not the place where you go. You need to find somewhere else. You laugh, but sometimes you might have to search a long time. Long time. Someone has had a lot of babies, or you have an elderly person, they're not going to look just like this. Okay? It is a real search and rescue mission. Okay? Once you've inserted once you've blown up the balloon, maintain pressure here and disconnect it, because if you don't, it's going to back up on you. Okay? Maintain pressure. All right, we are finished. Where do we want to? Where do we want to hang this? On the bed rail?
No, preferably under.
Where do we want to hang it? On the bed frame? Yes. Have your coils here on top. You can use this little clip to clamp the bed sheets. Keep it in place. Hang it on the bed frame. Now, in order to adhere it to the thigh, we use our stat lock. Ideally, you would open this skin lubricant put here to allow it to stick a little bit better. You're going to open this up. The arrow needs to be pointing upwards. And do you see this little thing right here? We're going to fit this Y of this catheter right in there. And then clamp that, and we're going to attach it to the thigh. And this is going to be able to move around without pulling on it. Okay? Any
Are we going
questions?
to use that for checkups?
So what I would recommend is go ahead and open up your stat lock. Just put it in the bottom of your catheter tray. Okay. To take it out, what do we need to do? Disconnect it from here. We need to deflate the balloon. Get your syringe. Usually when you attach it, it will deflate itself. You get a pad, a waterproof pad or something, and slowly pull out. And that's it. First thing you do, though, is always put your goggles on and empty your bag first before you take it out and measure your output. Any questions? Got it? Okay. You have any